Oh, okay, we have a few minutes. It's still fine. All right. Doctor's mic is on right now. Dr. Adeogun Charles is here in the studio. Good to have you again with us this morning.
Good morning. Thank you.
Good morning. All right, everyone. Like I said, you're free to start sending in your questions. Don't forget, last Thursday we were talking about women's health matters. All right, from fibroid to menopause to infertility, and some more anyway. All right, and I think last week the doctor was able to talk. Was it menopause you spoke on? Yes, in last week or fibroid infertility. Thank you so much. You know book now. You have the capacity. Right? And so we're just going to do a little recap, on infertility. Then we just move on. So talk to us.
Okay, so infertility is defined as inability of a couple to achieve conception, despite regular frequent intercourse, over a period of a year. So if they're not able to achieve conception, then we can say that they are infertile. And infertility, like we said, is not limited only to the woman. So the kind of investigations that need to be done would involve, both parties. So both parties will need to be thoroughly investigated, running the right kinds of tests to actually be able to detect where the problem lies. Because it's only when you identify the problem correctly that you can, put in the right interventions and the right treatments. So basically, we also mentioned, to recap last week, that 40% of infertility cases are attributable to male factors. So we can see now that male factor is actually a very significant aspect of infertility. So we need to overcome the cultural and social bias we have that, it has to always be a woman's problem when a couple cannot conceive. So both parties should be open to investigations. They should be open to regular hospital visits, and whatever treatments, is prescribed for them, they must, thoroughly adhere to it so that they can get the desired outcome they want. And we know that infertility, also comes with a lot of emotional distress, a lot of anxiety, a lot of depression in some cases, especially for couples that have been waiting for a long time. So it's important that we ensure that people who are going through this see the right specialists, and the right specialists will be able to detect where the problem lies and give them their best options to achieve their goal.
Okay, that's on infertility, right? Menopause. I think someone was asking a question the last time, and that if someone is above 63, can the person still carry a baby using the IVF system or something? You remember that question, right?
I do. So menopause is a condition. It's actually, it's not a disease. It's a normal phase in a woman's life whereby the normal monthly period ceases completely. And usually there is a phase called the perimenopausal phase whereby, the woman starts noticing irregularities in her period. The period, is not coming as regularly, is not predictable. And then you may even have months passing without having any period at all. And it comes with all sorts of symptoms. But typically, for most women, they attain menopause between the ages of 45 and 55. The average age being around 51 years old. And when this happens, they stop seeing their period, and a lot of hormonal changes happen because all the hormones that drive the normal menstrual cycle, start declining, and there are a lot of new things that they start experiencing. So that's the area where you start experiencing mood swings, experiencing hot flashes, experiencing, a rise in the blood pressure or some cardiovascular issues. That's where a lot of women also start having, bone-related issues that we call osteoporosis, because the density of the bone is not like before. So they are able to fracture their bones more easily, and so the bones get brittle. So depending on what they're experiencing at that time, they need to see their doctors, to make sure that any of the symptoms that are becoming unbearable, they are going to be handled appropriately, and they may need to be on some bone strengtheners, so to say. And it is around that age we also encourage them to be going for weight bearing exercises so that their bone density is maintained, so that they don't start having other issues, that would limit their movement or get them incapacitated. It's also very important that at this point in a woman's life, there are lots of emotional issues associated, because some women can't really tell what's wrong with them. They just notice they feel different, and then they are a bit more irritable. So it's very important that people around them should understand that they're undergoing a phase, and they should be supportive, during this time, rather than, just reactive. You have to help the person go through that phase, successfully. For some people whose symptoms usually get very severe, there are some options that, the doctor gives, but, it may not be applicable to everybody. Not everybody is a good candidate for what we call the HRT, the hormone replacement therapy, where, they are able to replace some of the hormones that are declining in the woman, because those can pose certain risk factors, to their health and increase their chances of having certain types of cancer. So it doesn't necessarily apply to everybody. That's why you don't take any decision on your own without consulting a licensed health practitioner.
Okay. I want to ask a question on behalf of someone, because let me first cite an example. I got to know a lady. She's a friend to my own friend, my friend's friend. This lady my friend was actually telling me that she sees her period just 3 times a year, either 3 or twice a year, and she's just perfect. She's fine. If you see her,
You don't know anything is
she's
wrong.
as fresh as anything. She's gallant. She's okay. She's okay. Sometimes once a year. Is that normal, really?
It depends on her age. We want to find out her age, how long that has been going on for. Is she in the perimenopausal group? If she's above 40, we would say, okay, she's probably nearing menopause. But if it lasts for a whole year and you don't see your period at all, then we say that you have actually attained menopause. But for some people who
She's in her 40s, really.
if she's in her 40s, then she's probably menopausal, getting close to menopause. If she's
Menopause is from what age, really?
45 to 55, usually around that age brackets. And some people have it earlier.
I thought it's always late 40s, like 49. No, 50, 51, 52, there.
Yeah, that's so 45 to 55.
And some people
that's
get to
the age
57
bracket.
gone, they are still good to go.
But now it's important that we mention that if a woman has attained menopause, you have not seen your period for a year completely, and you are in that
And
age
the following-
bracket,
the next year it
and-
will come.
and then it comes. Please, it's an alarm. Run to the hospital, because you may be dealing with cervical cancer. Because if you have attained menopause and you have any postmenopausal bleeding, please do not trivialize it. You may be dealing with cervical cancer. A lot of women, we are still creating awareness on the need of the cervical pap smear. I know that a lot of women.
What's that?
It's an important test. It's a screening test for cervical cancer, and it's one of the things that helps us to detect it early, in the earliest stage, when you have some things happening in the transformation zone of the cervix, whereby you're detecting the earliest changes that signifies that something is happening in the cervix. But a lot of women, we still have a problem with going for health screenings or wellness checks, either because of financial implications, or we just have a feeling that we are well. We just feel it's not necessary. You're wasting money. You don't have any complaints. But these are routine screenings that are very, very helpful. So a woman who has attained menopause and sees any form of bleeding must take it as an emergency and go and get screened, because you may just be dealing with cervical cancer, because cervical cancer still happens. A lot of people are still under vaccinated, for the HPV, which is one of the major risk factors of cervical cancer. And a lot of people still don't know that once you have attained menopause, you should not see any form of bleeding. There's nothing like, well, it still comes once in a while. It may be cervical cancer. So we need to create awareness, and we have a high index of suspicion for cervical cancer in women in that age bracket. So it's very necessary that we also emphasize the need for wellness check. We keep saying it over and over again. Don't wait for there to be a problem. Don't wait for something to go wrong, because the earlier you handle it, the better. We always say that early detection always produces good outcomes. But by the time something has gotten advanced or is already complicated and you're now looking for solutions, you're going to spend more money, you're going to go through more pain, you're going to go through a lot of complications that are absolutely unnecessary that would have been handled easily if you had intervened earlier. So it's always in our best interest to know that when something is wrong, you don't sweep it under the carpet, you don't wish it away. You do the needful. Go get it checked. Whatever the doctor recommends, you follow it.
I want to ask a question. There's some ladies that have had D&C, maybe one or two in time past, and then while they were young, out of fear that, hey, mommy is going to kill me, that is going to kill me, they went for this abortion process, and later in life they struggle to get a baby, just one. What happens in that particular moment? I mean, how would you describe that?
That's a very important thing to talk about, because the process of doing a D&C means dilatation and curettage. So you're going to be curating the endometrial wall, you're going to be scraping. So depending on who is doing it for you, and most of these people, when they go for these things, they go to people who are not experts, people who don't know their work well, because they're going to be looking for the cheapest link. And when you do that, you run into trouble, because at the end of the day, you find out that the person that has done the procedure for you has done what they should not do. And depending on the frequency of your D&Cs, you can also have what we call Asherman syndrome. Asherman syndrome is where they have overscraped the lining of the womb up to the point that there is now scar tissue there. And the scar tissue then now makes there to be adhesions. So the walls of the womb would now stick up together and there's a scar there. The person is not going to be seeing her period, and there is no way she's going to conceive. So Asherman syndrome remains one of the highest causes of infertility relating to repeated D&Cs. And then you can also have people have Asherman syndrome because they have a condition called schistosomiasis. That's gotten from people swimming in riverine areas. They catch that infection. It can also increase your chances of having Asherman syndrome. Then tuberculosis is also something that can also give you Asherman syndrome, because tuberculosis that we know is not only about coughing out blood. That's the pulmonary TB. You can also have other types of tuberculosis affecting other parts of the body.
Okay.
All right.
Okay. When you say, sometimes you see, you aside what I described earlier, some women have not given birth all their life, like from no miscarriage, nothing.
Never pregnant.
Never pregnant in their lives.
Yeah, correct.
They say this one cannot give birth at all. Like, does it happen?
Well, in some
Are
cases,
there ladies or women who are just here not to give birth, just go about your normal life like a man?
No, there are some people that are born with all sorts of congenital problems, chromosomal anomalies. You can have a woman with Turner syndrome. Her chromosome instead of XS is 45XO, for instance. So she will definitely have problems with conceiving because she has trick ovaries. That's how she's born. So there are some people that already have some issues that reduces their chances of having good fertility. Then there are other people that now have it acquired, either because of something that has happened to them or other conditions that they have. People that have hormonal imbalances, people that have PCOS, they also have fertility issues. Some of them may actually conceive, but they're always having recurrent miscarriages. Even if they do achieve conception, there would always be recurrent miscarriages. So hormonal problems.
So it's not a spiritual thing, like people will say.
No. Infertility is a broad topic. It's a broad topic that when you delve into it, you're going to see that there are 1,001 reasons why a person can be infertile. So there is primary infertility, there's secondary infertility. There are people who are born with issues that limits their chances of having children. So basically, you need a thorough investigation. So any couple that is dealing with infertility must undergo series of tests, and the tests are very, very exhaustive. There are a lot of them. So it's not where you now say, this money is too much, I just want to do this test and leave this one out. All of them are important because you don't know where the problem is. So it's just like a game of detective. You keep investigating, so you narrow it down to where the answer is, and immediately you can spot out where the problem is. Then you can now put the right interventions in place.
In this part of the world, once a woman cannot give birth,
She's a witch.
then it's not like she's a witch, but there's a spiritual problem.
Somebody is tying her womb.
Yeah, somewhere you start running from one church to another, from one spiritual home to another, and all of that. And I don't know.
No, but let's not trivialize spiritual things. But the truth of the matter is that yes, we believe in God, and we believe that God can intervene in situations. But all the same, have a clean bill of health. Make sure that where it comes to medical investigations, you have been thorough and you have gone through all the right investigations. Then God can help you. But not for you to just not do anything and hoping that what you want would just drop in your hands that way. It doesn't work that way. You have a role to play. So it's very essential that everybody takes their health in their hands, see the right professionals, because I keep emphasizing it. The right professionals is very key. Professionals are different from professionals. Let us be honest with ourselves. Some are more thorough than the others. So the truth is, find good professionals, seek the needed help, follow the instructions, go for the investigations, and follow their recommendations, and you will have your outcome.
Still talking about menopause, I've heard or seen a woman age 57, 8 who sees her monthly flow. What would you call that?
It's not completely impossible, but anything that you see that is abnormal or that is not expected, you should also go to see your doctor. If you think that you are getting to 60 and you're still seeing your monthly period, and we know that on the average, most people attain menopause between this age and that age, please go to see your doctor. There are many things that
are you saying it's bad? I mean, it's not supposed to be.
Please just go and investigate it. Never normalize anything. Go and investigate it.
But people tell you the system is different. Yours is different from mine.
But there is nothing wrong in you going to your doctor to have it checked. If you're going, it's just like somebody who is maybe 7 years old, a child of 7 years old that still can't walk well or talk well. Would you say that is normal? That is not normal. But some people will say, no, it's just a slow learner. No, he will catch up with time and all that. And whereas there's a big problem going on that you're missing out on. So immediately, because on the average, research has been done. This is science. This is medicine. Everybody knows that on the average, within this age bracket, this thing should happen. Just like a child, there's a certain stage where a child is expected to crawl, is expected to walk, is expected to talk, is expected to interact with the environment, is expected to be independent, can do certain things on his own for himself. And if that child is not doing that, where all his other peers are doing those things, it should be an alarm. Though we have some people that catch up a bit later, but don't assume that by yourself. You're not a medical professional. That's my point. Go and still get it checked. Let the professional investigate, make an assessment, and tell you, let's do a watchful wait. Let's see. Let's give it time. Than for you, who is not a medical person, to assume that it's fine, whereas there may be fire on the mountain. So please, let's not dread going to our health professionals. Go to them, have it investigated.
Let's go deeper. Have you not seen a woman of 60 give birth?
I have not personally seen.
I have seen.
I'm not saying it's impossible, but I have not seen.
But some will say it's IVF. But the fact that she's 60, is it possible? Through IVF?
Yeah, she can get donor eggs. Yeah, why not? If she gets egg, it's likely not going to be an egg.
Back to that question that that woman asked.
Exactly how I answered last week. Donor eggs. That's what you do. And you make sure that, of course, the sperm you're using is also a viable one. The fertilization is done properly, by an expert fertility consultant. And yeah, it can happen. But I doubt if it will be her own eggs. So she would have to get donor eggs. Except she has had her eggs frozen years before then. That's the only way that works. But for you to have it under natural causes, never say never, but possibility is slim.
Okay.
Because all the hormones that should support pregnancy and fertility in menopause, they're not there anymore.
How do you mean they're not there? They're weak or?
Not practically non-existent. That's why most women after menopause can't conceive, because you're not even seeing your period again. You need to see your period to be able to conceive. You need to ovulate to be able to conceive. So where are the eggs coming from? So that's a normal phase in the woman's reproductive health cycle. So once a woman attains menopause, the possibility of getting that done, unless she has donor eggs, is quite slim. That's why we mentioned a test called AMH last week. AMH, anti-Mullerian hormone. is an indicator of your ovarian reserves. So you're able to know how much of your ovaries you still have left, and that also dictates your chance, or like a predictor of your fertility. How attainable is that conception going to be? And there are other things that come with increasing maternal age in terms of the child's development and other problems that the child can also have. Remember, we've mentioned before that any pregnancy after the age of 35 carries an increased risk of Down syndrome and other chromosomal anomalies, congenital problems in the child.
Okay.
So the higher the maternal age, the more the chance that the woman will have a child who has those syndromes, particularly if she has had a child like that before. If she has had one Down syndrome child, for instance, the likelihood of it happening again is there. So the older she gets, the higher the risk.
I want to answer one or two questions. All right. So if you can send a WhatsApp message to me right now, maybe I'll just read it out and the doctor will answer your question. Okay. I think I have several questions here already, but because of our time, I'll take one or two. Don't forget, you can also, we've created a platform where you can have a conversation with a doctor. Okay. Himself here, and some other doctors, surgeons, and all of that, they are all in that platform, right? That is, what do we call it again now?
Doctor's
Mike on Facebook.
On Instagram.
Doctor's Mike on Instagram. Doctor, just spell doctor, then apostrophe S. Then Mike is MIC. Doctor's Mike on Facebook. Doctor's Mike on Instagram. Okay? A lot of doctors are there, especially packed like that, so you can, get what you want. Yeah, courtesy VOPFM. Okay, now, let's see. Somebody's asking, said, I love this guy, this doctor, yeah? He's a real Agba doctor. Will it be possible I ask how old he is? No, you cannot.
Tell the person to guess.
Abi. But let me let you know, he's been practicing for a while. Yeah, he's done a whole lot of stuff in around the country. Like I said, in and outside and around everywhere in the country. No, he's a sure person. It's not just before if you sit down for where you sit down, so say not be my.
I want that person to message me on Doctor's Mike.
Okay, that's nice. And let me read this message. I would like to get contact. Okay, and that's what we said. Just go to Doctor's Mike quickly. I'm wrapping up because I need to leave here by 11:48. We should be wrapping up because of some of the paid announcement. Okay. So let's see. A couple of faces are typing, like plenty. I am seeing the thing is just popping. They are typing seriously, but if only yours can get in as quickly as possible, I will get to read it. He said, no wonder the experience is there. Thank you. Okay. He is saying, doctor says you should, all arms, should he? All arms. He said you should go and talk to him on Doctor's Mic. Okay. Drop a message there. And everyone, please follow. Okay. Follow, and you can also share with your family members. Let them get in touch there. Ask vital questions. Get good direction. Get good physicians. Just, be able to talk to you. Exactly. Voice of the People 90.3. I wanted you to talk about fibroid, but the time is not our friend. Doctor's Mike is only on Instagram. Why not on WhatsApp? No, now just go there.
It's on Facebook too.
It's on Facebook.
Yes, it is.
Facebook now. At least you're on Facebook. Just go to the comment section, the message.
The message. Just drop a message. Drop a comment.
Now, like WhatsApp, is still be. Yeah.
Thank you.
Good morning, doctor in the house. This is a realistic doctor, not Google doctor. She calls from it here. Okay. Thank you so much, Shay. Thank you. I actually wanted you to talk about fibroids. Fibroids. But can you just touch it a little before we wrap up?
Okay, so fibroids are they are growths, non-cancerous growths, that you find in the womb of a woman. Is usually composed of connective tissue and smooth muscle, and usually it's a bit high in women of African descent. we have a higher predisposition.
When they
for
say
that.
African, I don't understand why it should be African.
That always has
women.
all
Yeah.
these issues. Well, there are lots of theories to that. Diet and vitamin D deficiency, has also been linked to that. The darker your skin, the less vitamin D you can absorb from the sun rays. So so we've also noticed that women that have vitamin D deficiency at an increased risk of developing fibroids. But the important thing about fibroids is that everybody, once they hear fibroid, they're thinking of fertility, but fertility is not the only issues that fibroid brings. Fibroids can make you have heavy menstrual flow, prolonged menstrual periods, having to change your pad, very frequently, passing out blood clots. And then it can also have pressure symptoms. It can impinge on the bladder. You can have pressure symptoms making you want to urinate all the time. It can also cause intrauterine growth restriction, meaning that it's occupying space in the womb, allowing your baby have little space, for growth and all that. And then also, it can also cause what we call postpartum bleeding, because it's going to be occupying space, and when your baby is out and the placenta is out, it doesn't allow good contraction of the uterus. So you may have prolonged bleeding after childbirth. But a lot of people also have some complications of fibroid, like red degeneration, where there's extreme pain, pelvic pain and all that, and it's quite unbearable for a lot of women. And when you're losing blood excessively every month, come with lightheadedness, dizzy spells, fainting spells, tired and all that, no energy. All those things are quite distressing for a lot of women. They can even start having shortness of breath because of the extreme blood loss. And some people may need to go for blood transfusion. And in some cases, we just have to tell them we need to do a surgery called a myomectomy to remove the fibroid.
You don't do, doctor. You don't do. Our time is up, really.
All right.
If you pass this one, we'll just... But everyone, don't worry. We'll continue this conversation on Thursday. He's always with me every Thursday, all right, to talk about your health, all right? And so we have been looking at fibroids, menopause, infertility, and much more. And this is like the part 2. Part 3 will be next week by the special grace of God.
So we need more interaction on Facebook, on Instagram. All our friends, please just come on. We'll be happy to help you.
Thank you. Doc, thank you so much for coming.
Thank you for having me.
All right. My name is Jude. Ikami Jude, okay? On social media, I am just Ikami Jude. Just go there, check IKAMIJUDEH. Ikami Jude. My name is Jude Ikami Jude. I'm out of here. I'm out of here. Do have a beautiful and a wonderful day today. Good morning to you.